what is the difference between a veneer, a dental veneer, and a dental lumineer? You know, we see advertised on television, lumineer, 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 and kind of, what is that? Well, you know, where's this strange word came over the last few years so often? To me, they're all clip-on nails. Well, clip-on tooth nails, I guess. Anyway, tell us about, you know, lumineer, veneer. What's the difference? Do we patients really need to care about it? Is it important? Shoot.
Well, lumineer is a veneer, is a regular veneer, but without preparing a tooth, meaning without shaving a tooth for the veneer. It doesn't mean it is better or worse. It doesn't mean that a regular veneer is going to look worse than lumineer, or lumineer is not going to ruin your teeth. It's not about ruining your teeth. It's about creating a better smile. Not every case is a lumineer case, meaning some people do need to have their teeth a little bit grind to place veneers. It all depends on individual. So we do I do both in my office, lumineers and veneers, and it is basically it's once we do the consultation, I will explain to you what is better for you, lumineer or veneer. But veneer is the same as lumineer in a case it's a replacement or coverage of your teeth with a very thin contact, like an eye contact layer, a porcelain layer on your teeth, to creating a better aesthetic smile. Like some people want very white without whitening the teeth, or something very nicely shaped. That's the reason we do veneers.
Got it. So basically, what you're saying is that a veneer is a little thicker in terms of like that fingernail, that tooth nail is a little thicker, so you need to grind the tooth a little down so it fits on it. Otherwise, the tooth will be like a huge thing when you put it over it. And a lumineer has thinner material, so if the tooth is already straight in it and all you want to change is the color, or maybe it was chipped a little bit, so then you don't need to grind the tooth down, so you maintain the structure of the tooth, and I guess you don't need an injection in that case. You don't need to numb the tooth for grinding it. And then you put that.
You don't need the injection in both cases. In most cases for veneers, yeah, you don't need, because the grinding of the veneer of the tooth for the veneer is so minimal that you do not need the injection.
I see. So that is thing. So basically, a lumineer is just a different brand. Is that basically what it is? Kind of like, you have you have an Apple computer and you have an IBM computer, or in IBM you have a Sony and you have a whatever, a Hewlett Packard.
Yes, Lumineer is a brand. Lumineer is a brand name of the veneer. Yeah, it's a company who created that veneer and they call it Lumineer.
Got it.
It's a regular lumineer.
Right. So, and it is that in this case, it's really the dentist who says, look, the lumineer would fit you better for whatever reason it is. But for all purpose, if the dentist never mentions it to the patient would never know, it wouldn't matter.
Exactly. The patient would never know if it's lumineer or veneer unless they hear it on a commercial or they come in just specifically for lumineer.
Right. It's like if I go to the car mechanic and he puts new brake pads in it, he doesn't tell me which brand he's using. He's just using whatever brand he thinks and whatever. I got it.
Absolutely, yes.
Good. Now, what are veneers and lumineers are used for? I mean, what are some of I know they're obviously cosmetic dentistry. They give you overall, the idea is to give you a beautiful $1 million smile, like Julia Roberts smile, or Angela whatever smile, or Tom Cruise, Brad Pitt smile. But what are the situations? I have also heard that a lumineer or a veneer is kind of an instant orthodontic. Explain that.
Yes, let's say you have spaces between the teeth and you don't want to go through 2 years of braces and you want to have an instant, straight, beautiful white teeth. So we do veneers in that case. Also, some people, when they were kids, they were given tetracycline and they have a brown like a line throughout their teeth, which cannot be whitened with anything. So we do veneers in that case to cosmetically improve the shape, the color, the smile itself on people.
Mm-hmm.
And also, if you have all very crooked teeth and you don't want to go through 2 years of braces, then we do veneers also.
Right. So basically, a veneer is almost like, you know, giving your house a new siding, and you can decide whether you want it flat, you know, thicker, you want it blue, green, you know, maybe you want your teeth a little longer.
Right.
Maybe whatever. Because you dentists, I mean, it's a very clinical and technical profession, but at the same time, it's extremely artistic, isn't it? It's because
yes.
It's like me buying, whenever I go and buy suits and ties by myself, or even put them on in the morning by myself, and I look by my wife and she goes, no, honey, go back. This doesn't fit together. You understand? So it's a little bit like that. You, the dentist, can see there of like, you know, one person maybe has a face which is or whatever it is. You have a good feeling of what fits with what, and that's how you, with lumineers and veneers, or crowns for that much, can
change.
Can make it
change the smile.
Can change the smile, and by doing so, the whole make the person like really being what he, you know, like clothes. You know, in Germany, well, I'm from Austria, but in Germany we have, in the German language, we have that saying, clothes make people. It's not totally true, but yes, it makes a big difference whether you're slappy dressed and a little dirty versus you're like James Bond, like with a perfect whatever. You see what I'm saying? And not everybody fits good in a James Bond suit. You know what I mean? I start not looking so good in it anymore. The stomach is getting too heavy. That's basically what it is. You're making a complete makeover of the mouth, fitting the body.
Exactly, that's exactly right. We're changing. If your face is too long, we can make it a little wider. If it's too wide, we can look at a little more narrow. So, you know, to make you look, you are beautiful always, but we can make you a little bit more beautiful.
Right, beautiful.
So
gorgeous.
You can actually smile with confidence.
And I have said that, you know, a smile, I mean, it's not just as a smile is a smile. I mean, there is nothing, they say there is nothing more important than having that smile. It opens your doors. It wouldn't matter where and which and for what. And I have
You feel better. You feel better.
Yeah.
Your mood when you smile more.
Right. So absolutely wonderful. So to end it off, veneers, lumineers, don't worry. Don't even bother asking what it is. Just go and look in the mirror and see yourself smile, and then see the people around you saying, you know, he or she has a great smile. I mean, she's comfortable to be around because she always smiles. Of course, you want to show off your beautiful teeth, right?
Yep.
Thank you very much. Thank you very much.
You're welcome.